Hello. Okay, I just started the recording. We are rolling here. So good evening, everybody. Thank you for joining us. It is great to be with you tonight to talk about a sort of newer therapy for us. It's not brand new, but a newer therapy for us that we're really excited about. And give me just a sec to check that, like, the techie bits. Can somebody just put in the chat that you can see me and hear me, just so I know that we're not talking to ourselves? Oh, somebody. There you go. Thanks, Gemma.
Thank you.
All right. Thank you, guys. Okay, so let me just give you a little bit of a layout for what we're going to try and cover here this evening. So firstly, I will introduce myself in just a minute for those of you that don't know me. And I also want to introduce you to Dr. Julia Britz. She's a naturopathic doctor, and she's just joined us here at Restore Medicine. I'm very excited to welcome her and introduce her to you guys. So we're going to talk about peptide therapy tonight. We're going to sort of give you a big picture of, like, you know, what is that? What does it look like? How is it done? And we are going to go in and talk about some specific peptides. Now, we wanted to keep this pretty informal and just kind of, you know, like, have it conversational. We will tomorrow send out a fairly detailed summary. I put it out by email last week, so some of you may have that already. But basically, like, the information on the specific peptides and such, feel free to take notes all you like, but I just wanted to let you know we are going to send out tomorrow kind of a handout that puts some of the facts on paper, so you don't feel like you have to get every last thing. And then we will try to have time for Q&A at the end. I think there should be time for that. So if you have questions along the way, go ahead and put them in the question box. And I'm sort of monitoring the question box and the chat here. So if we can address some of those things along the way, we will. Otherwise, we'll try and get to them at the end, or we can follow up with you later too if anything goes unanswered. So, with all of that said, I felt like a lot.
We did it.
So for those of you that don't know me, my name is Dr. Nicola Duchamp. I'm a Lyme literate naturopathic doctor, and I'm based here in San Diego, California. I'm the owner and medical director of Restore Medicine, and I've been working with chronic Lyme for about 15 years now, maybe a little more. And, you know, it's a tough one for sure. And so we are always looking for kind of novel therapies, looking for what can help, looking for ways to help the body with chronic illnesses such as, you know, Lyme disease, chronic inflammatory response syndrome. You know, the mycotoxin illness is just becoming kind of a bigger and bigger thing. And some of these chronic neurological conditions and neurological sort of repercussions of these other things. So now I'm going to introduce Dr. Britz. She just graduated from Bastyr University, which is the same college I went to, but I went to Seattle campus. She went to San Diego campus. And she has a long history of being very, very passionate about natural medicine. I'll let her share her journey a little bit with you in a minute. But specifically too with these peptides, like, she's been looking at this for a long time. So Julia, can you just sort of introduce yourself, give a little bit of background, and also a little bit about sort of what got you interested in peptide therapy and kind of what your background has been with that?
Yeah. So my name is Dr. Julia Britz, and I got interested in naturopathic medicine just because of my own poor health history. I had a lot of mental illness and things like that. And so I was very much helped by targeted amino acid therapy, which even in itself is still pretty specialized. But I got really interested in peptide therapy because it was almost like the next level of that. Or at least, I don't even want to say the next level, but I do want to say it was like another direction to go with it. So I thought that was really fascinating and interesting. And so I started delving into research, but it's very new kind of therapy. So it's been something that I've just been working on slowly. And so that's why I'm really excited to be working with Dr. Duchamp about this, because there's so much that we can apply peptide therapy to Lyme disease and all these different kinds of things in addition to mental health. So it was a nice little bridge and a very safe therapy. And so it seemed like a really good opportunity for us to bring something like this out for people. So we're excited about that.
Absolutely. Yeah, totally. So let's just start with some of the basics. Like what are peptides? Like how would you distinguish a peptide from an amino acid?
Yeah, so peptides are basically baby proteins. And so this means that there are strings of amino acids that tend to be somewhere between 15 and 50 amino acids. So when you think of an amino acid, what comes to mind would be like tyrosine or leucine or whatever. So this is a very specific thread or message. So it's kind of like an analogy that you said that I love, which is alphabet soup. You can have all these different letters, but it's only when they're in this correct order that you actually get a string of words or a sentence or a specific message. So that's what makes them unique, and different from proteins too. So proteins do act like hormones in the body. Peptides sort of are like hormones junior. So an example of one that people know about already is insulin. So insulin is a peptide, has a very specific function. It regulates your blood sugar. That's basically what it does. Maybe a few other little things, but that's the main thing. Whereas when we think of a stronger, bigger global hormone, we think of thyroid hormone that affects everything, our skin moisture, how our bowel movements are, hair, sleep, you name it, everything. So peptides are different because since they're shorter strings of amino acids compared to the proteins, which are long, they're very specific in what they do. And they don't have this global effect. They tend to have very specific effects, which is really cool because then we can therapeutically target one thing without so much of disrupting everything else going on at the same time.
Right. So that was one of the things that I thought was cool too, because so many therapies, like you sort of put this thing in hoping it does that, but there's other impacts on the body. But peptides are very specific and they are produced by our bodies, right? So we produce these peptides to have very specific jobs. And so we can utilize those peptides to fulfill those roles. And yeah, I think that analogy of the alphabet is good. So, you know, I'm the mom of a kindergartner, so I'm all about like putting letters together and words together. It's like, it's, you know, it's my life. But what I like about that is, yeah, so if a protein is, you know, you have the alphabet and that's the whole protein. And then amino acids are very, you know, are single letters. And so a peptide, you know, it's like to get a certain word, you need a very specific sequence of letters. And so I had a question, and the reason this conversation came up with Dr. Britz and myself, I had a question about why can't we just eat meat and get amino acids? Wouldn't that fuel the peptides? And, you know, my response was, but you need very certain specific sequences of these amino acids. You can't just sort of toss them all in the system and hope that they find their way, because they may not. So that's why it is so targeted. But to Dr. Britz's point, because they're specific, you know, we don't have a whole lot of other side effects and effects on the body that may be unpredictable or undesirable.
Exactly. So, and that's another thing that makes them really cool and different from hormones in that way, is that they tend to be very short acting. So they don't stack up in the liver, which can be helpful because sometimes hormones, we got to be really careful about the dosing, and it can be kind of tricky. Peptides, we don't have to worry about that quite as much. The response tends to be more rapid, and tends to be, again, precise tissue selective effects versus the global broader effect.
Yeah, perfect. So, so how are most peptides administered? Do you want to talk about that a little bit?
Yeah. Okay. So most peptides are administered via injection sub-Q. So that means like your belly, tiny little baby needle. And that's because a lot of them it's the form they're stable in. So there are some peptides that you could get in a capsule, but it's not the same as having one peptide and it comes in either a capsule or either this or either that. It's that whatever that peptide is stable in is the form we can get it in. So most of them are injections. There's maybe a couple that are in capsules, and there's a couple that are nasal sprays. And that's because some of them can really penetrate the blood-brain barrier. So having a nasal spray is the best way to get it into the body. But since they are peptides, they're not really metabolized in the liver the same way. They sort of are more in the bloodstream, and that's actually where they get deanimated as well. So we want to get them into the sub-Q. That's the best way to do it. We get a quick response. But yeah, some people don't like needles, but really, really tiny, so that's good.
Yeah, it's little insulin syringes. So it's itty bitty, but it's a subcutaneous, it's not intramuscular. But I do want to make the point too, before we go any further, just to be really clear, peptides are prescription items. They come from a compounding pharmacy. They're not something that you just sort of, a supplement that you order online, or, so they are sort of prescription level here. So just in terms of like, just to give you that context.
Yeah, and that is important because I do read a lot about people getting them on the internet, which can be pretty dangerous and something that we are pretty like, don't do that. And honestly, there's some supplements I'm like, yeah, you can get that wherever, I don't care. But this is one where I would say definitely do not, because purity is so important. Standard of testing in labs is so important, and knowing how much you're getting. And it's like any other drug, you know, you have to make sure it really is exactly what it says it is, without being adulterated or with anything else, because they do have to buffer it. They do have to put preservatives in it. We want to know exactly what it is, so we know exactly the response we can expect. So.
Yeah, I mean, I would absolutely second that. Anything you're injecting into your body, you want to be pretty careful. So just going online and ordering some random peptides from some random place is probably a bad idea. Uh-huh. So before we go, we do want to talk a little bit about NAD, which isn't strictly in the peptide family, but it is it's utilized a lot with peptides, and it can be very, very beneficial in conjunction with. So NAD is not sort of easy just to take in a supplement form. There is an NAD synergizer made by the same people that make the Protandim Nerf1 and Nerf2 that has been proven to boost NAD levels, which is awesome. But we want to talk a little bit about NAD, either subcutaneous. So sub-Q means subcutaneous. We're just going to use that acronym for now. And we'll touch a little bit on IV, but we're really going to sort of lean more on the sub-Q.
Right. So NAD stands for nicotinamide adenine dinucleotide. And this little molecule is typically made from niacin or B3 or tryptophan, and some other things in the body can actually salvage that pathway to make it. Now, the reason why NAD is so important is because we all naturally make it in every cell in the body. And it's what makes your mitochondria, which that should be the word we all love to hear, really light up. It gives them the energy they need to do everything they do in the cell. So we also, unfortunately, naturally lose NAD as we age, which is so sad. We also lose it.
You age?
I know, right? I hate to break it to everybody, but
I don't age.
And also chronic illness will decrease the levels. Any kind of oxidative stress, including sunburn, any kind of emotional stress, so basically life will just really deplete it. So it's used a lot. We can synthesize this just like any other vitamin, and we can take it in therapeutic doses, and cells will just drink it up, and we can help replete some of those levels. So it's used a lot in anti-aging medicine. It's used a lot in addiction medicine and pain management, any kind of diseases that create a lot of fatigue. So like MS, chronic fatigue syndrome, Lyme. Got to be a little careful with that because sensitivity and that kind of thing. But essentially, there's a lot of places for it. And so NAD naturally created by the body, just like peptides are. So that's why they do kind of go well together.
So NAD can be given by IV, but it's tricky, right? I mean, it's a long
drip. It's a long drip. It takes 4 to 8 hours to drip it. And I actually just had to drip this last week. And I mean, it's great to sit there and relax and everything, but at the same time, you got to be very careful with the drip rate, because it is what they also call the master metabolizer. So even a little bit higher, you know, kind of getting a flush, and it sort of reminds you of niacin a little bit, and just felt like a little hungry and that kind of thing, kind of a little fast heart rate. You just turn it down and you're fine. But you do, because of that, you have to respect the drip rate and sit there through the whole thing. It's kind of a big commitment in that way.
I wouldn't have the patience.
But we can do it SQ. So if anyone's ever had a B12, B complex shot where it doesn't feel great going in, you're like, oh, the muscle kind of hurt. So that's kind of how the SQ injection of NAD feels. It just is like, oh, it doesn't feel great going in. It's not a big deal. But still, it's a quicker way to do it. and we can still get a nice dose of it. And it just needs to be done that way because it's not very stable. It easily oxidizes. So you kind of have to get it right from its molecular form in that solution, and then get it right in the body as quick as you can.
Right. So SQ is also subcutaneous. So we just wanted to touch on the NAD piece, and now we're going to move on and talk about some of the peptides that we feel have the most application. There's many different peptides out there. We'd be here all night talking about them. So we're just going to kind of hit on half a dozen that we feel are most relevant for this context. Now, if somebody comes in and they're mostly healthy and say, I want help with weight loss, I want help with sleep, there's different peptides for that. So we're focusing tonight on more chronic conditions because that's really our wheelhouse. That's what we're working with. And so we felt that would be the most relevant to you guys. So let's go through. I've got a little cheat list here. Dr. Peretzs, do you want to start with the Thymus Alpha1?
Yeah, so this one is, I believe, the only FDA-approved peptide right now. Okay, let me take that back. There are many orphan peptides and FDA-approved peptides when used in the context of adjuvants of other drugs. So we do use peptides with chemotherapy, antiviral therapy, etc. So they're very, very safe because we naturally make them in the body, but because they're sort of in between the supplement and the drug world, they don't have a lot of, they don't know exactly how to use them on their own, and they're very new. So they're sort of orphaned right now, but we have found quite a lot of use for them in research. And so, and again, I do want to stress that they are very safe. So Thymus Alpha1 is the one that's getting a lot of hype right now because it's produced by the thymus gland. It helps produce the development of B cells into plasma cells. And it helps regulate the Th1, Th2 cell balance, which in a lot of chronic illness will get Th2 dominance. And so it helps just gently bring that back down. And it can normalize.
That causes a lot of inflammation, doesn't it? Like that Th2 dominance is a really big deal, like in our chronic folks.
Mm-hmm.
And so having regulation of that is a really big piece.
Yeah, and it can gently do that, which is really nice because sometimes, especially people that have chronic illness, as you know, they're so sensitive. So we want to make sure we can do something that packs a bit of a punch without being too harsh. And this is kind of that nice little balance. So clinically, what we see with this is improved tissue repair and healing, improved host defense to infection, improved microcirculation, improved stress tolerance, which is a big one. It inhibits viral cell replication, which is why they're studying it right now for using it for Hep C, Hep B, and HIV. So it's pretty impressive in that way. It can reduce immunosuppression, which is big, reduce autoantibody load, which kind of happens a lot with Lyme chronic illness. We see a lot of this sort of autoimmune looking picture. So it can help with that. Reducing inflammation is one of the biggest things it will do. And actually this drug is approved in over 30 different countries right now. It is in a vaccine adjuvant. I forget which one. I'm not really sure. But yeah, it has a lot of effects. So we're I love this one. It's a good one.
Yeah, I mean, it sounded to me as I was researching too, that this is the one of the immune regulators. This sort of seems like it's the most applicable to our Lyme mold kind of patients.
Mm-hmm.
But also then having the ability to kind of switch off some of the autoimmunity is huge.
Yeah.
And help the tissues repair and heal. So there's a couple that are sort of relevant to immune strengthening and immune support. So the thymosin alpha-1 is one of them. And then do you want to talk a little bit about the thymosin beta-4?
Yeah, and that one is very similar because they both come from the thymus gland. So they both really do modulate the immune system very nicely and in a very similar way. I will say the alpha-1 tends to be slightly more of an immune stimulant, whereas the beta-4 tends to be slightly more of a modulator. Different in every person, but slightly. So, and this one, I like to think of it as more for, in addition to the immune effects and the inflammatory effects, it can reduce a lot of pain and reduce damage to tissue. So this one, we're thinking of more soft tissue effects. So if someone has maybe some damage with their vasculature or maybe post-MI, things like that, fibrosis, this one would be very applicable. And a lot of people that do have damaged veins because of the extra clotting and all that happens with Lyme and chronic illness. We see sometimes like damaged veins. This one might be very helpful for that. And it's actually also been used with autism and traumatic brain injury as well. So it tends to be very regenerative as a peptide.
Gotcha. Perfect. Yeah. So there are sort of two favorites for immune function. And so it's an individual sort of consideration of which is going to be the best for a certain, person in a certain situation. So that's sort of part of what we guide people on. So let's talk about the BCP 157.
Oh yeah. So BCP 157 is actually pretty popular in the bodybuilding community right now. But which is great because there's so much feedback coming in. So this one is a 15 amino acid string, so it's pretty small. We actually get this in our human gastric juice is where we find it. So they found that if they synthesize this and then do an injection, or this one's a capsule one as well, it tends to be very regenerative. So when taken in capsule form, this one has a strong affinity for the gut, because that's exactly where it's going, and it helps to repair the damage because it's a very regenerative peptide. This one is also from the thymus gland as well, so that's why it has a lot of immune modulating effects as well. They do a lot with this one in IBS. It can stimulate EGR1, which can act on VEGFR2. So what that means in regular terms is that it helps repair blood vessels. Angiogenesis helps make new blood vessels, helps repair the vascular tissue. So this one is often used a lot with the beta 4 because they're sort of doing something very similar with the blood vessels, which can be really nice. This one is used a lot for pain and regenerating tissue that connects to bone. So when we think of tendinitis, that kind of thing, that would be really applicable. People ask a lot, do you want to inject it right into where you're hurting? The research doesn't really show that is any better than just injecting subcutaneously. So,
yeah, I thought that was so interesting with the BCP 157 because it's produced, in the digestive system. And so it's very healing for leaky gut and calming for IBS and can be Crohn's and UC and all of those things. And then also connective tissue, like healing injuries.
Yeah.
And so in this one in particular, what I gather is how you take it depends a little bit on what you need it for. So I have chronic Achilles tendonitis. I've had it for years because I refuse to stop running and I'm stubborn. And so I have started the BCP 157 and I'm doing it sub-Q because I want it to go to my Achilles tendons and heal that. Other people might do it as a capsule if they're using it more for digestive function because it is, kind of bioavailable when you swallow it. So it just depends on what you're using it for. If it's like gastric ulcers, H. pylori, UC, Crohn's, whatever, then some people might choose to do a capsule and that would be okay. And in those autoimmune conditions, we would typically couple it with one of the thymosins that we just talked about. And I also noted that the BCP 157 can actually reverse nerve damage, can actually help repair nerve damage.
Yeah, and it also increases growth factor a little bit, which can be helpful in Lyme because there is that, like, can I work out? Can I not work out? When I work out, I'm down, and so this can be helpful for getting some of that muscle tone back just a touch without actually pushing someone too hard.
Yep, absolutely. All right, let's touch on LL37.
I really like this one. Okay, so this is...
You like all of them.
I know, I like all of them. Okay, so this is the antimicrobial peptide. I know but if you think about it, our bodies do kill microbes too. So this one is a specific peptide that we get from stem cells. So this one is a defensive peptide in that it tends to be sort of a broad spectrum anti-microbe for killing anything of all kind. So, but one study found that it killed Borrelia cyst better than tinidazole. I know, like, isn't that so freaking cool? So this one, I do follow a doctor up in LA, Dr. Ken Holtorf, and he recommends pulsing this one a lot. And this one, we see a lot less herxing, which is kind of the general consensus with peptides across the board. And again, it's just because we naturally make them, so the side effect profile is just super low. So.
Cool. But this could cause hoaxing. This more so than the immune modulators. This one's a little bit more targeted as an antimicrobial.
Exactly. Yeah.
Okay. Cerebral Ison.
Oh yeah, Cerebral Ison. Okay, so this one is a very neuroprotective. Okay, we have neotropic peptides, meaning that they are, what's the word I'm thinking of? I can't remember, but
Nootropic, so like influencing the brain, cognitive function, like neurological function.
The thing I need right now. So this one really has strong neuroprotective qualities. So what it does is it's very fast and easy to pass the blood-brain barrier. So it has a very similar property effect to nerve growth factor. It can improve the efficiency of the nerve's abilities to work in an aerobic environment, meaning that the brain doesn't need quite as much glucose, which is super cool. It can also shield the neurons from lactoacidosis and prevent free radical damage, which is super important in things like Alzheimer's, Parkinson's, traumatic brain injuries, and of course, anything else that's affecting the nerves.
Yeah, I mean, it definitely, like the significance of this one to me is just the nerve repair and regeneration, and like post-concussion syndrome, traumatic brain injury you mentioned, Alzheimer's, motor neuron disease, like all these different things that this one has the potential. We get a little frustrated. This particular peptide can't be shipped directly into California, which not everyone watching this is going to be in California, of course, but there are some restrictions. California is such a funky state. So there are some restrictions on which ones they'll ship in directly. It's because the pharmacy, we'll talk about the pharmacy and whatnot in a little bit, but they have to, and I may be getting this a little bit wrong, but I think they have to have each product like approved by California, whatever. We won't get into that. So it's a little harder for us to get our hands on, but it can be shipped to other states within the US. Mm-hmm. But I just think the potential, because the mold illness, the Lyme, all these neurological issues are so damaging for the brain. And so this one, I think, has a huge potential to really, be influence and repair that.
Oh, absolutely. Especially when you think of brain fog and memory decline and inability to sleep, like all that stuff.
Yeah. And we haven't really talked about peptides relating to sleep, but there are a couple of other ones that have some kind of relevance for that. So I know a lot of people have the sleep issues, so maybe we'll talk about that another day. But all right, so let's talk now about the two that can be done as nasal sprays. I think this is really cool. These are working more on like anxiety and mood.
Yeah.
So doc, sort of differentiate them for us.
So we have two that come in the form of nasal sprays that are also nootropics, Celank and Simax. Now, these ones, the reason why that we take them as nasal sprays is because they cross the blood-brain barrier very easily. So it's the quickest way to get them in the brain where they are affecting our neurotransmitters. That's actually a much better way to do it than for these to be done subcutaneously. So these ones are easier in that sense. Now, they're very similar in that they do reduce anxiety. They're both used for depression and all kinds of mood disturbances, but they're slightly different. So I'll go over each one. So Celank, this one was discovered in Russia in the 90s. It's very similar to a hormone we make in the body naturally called trypsin. It binds to GABA receptors, so that's going to reduce anxiety. And it also, they don't clearly know how, but it does play an effect on the levels of dopamine and serotonin and norepinephrine in the brain. Some studies shows that it reduces those levels. Some studies shows it increases them. So I don't know if I could really call it a modulator, but it does affect them. We can say that. But clearly what it does show at this point is that they do affect the GABA receptors for sure. It does not.
GABA is one of, just to butt in for a second, GABA is one of our calming neurotransmitters. So we have sort of more stimulating neurotransmitters like our brain chemicals, and we have calming ones. And GABA and serotonin are two of the main calming ones. Epinephrine and norepinephrine tend to be more stimulating. And dopamine is part of that pathway, but dopamine is very much also associated with like the pleasure kind of center and the soothing kind of feeling. And so, like in substance abuse, for example, dopamine is like sort of high up on the priorities list. So they're just brain chemicals that we can influence. And but primarily here in a calming way, because most of our patients are struggling with like overstimulation and anxiety more so than the opposite.
Right. Yeah. And so that this one, it's I guess it's similar to the idea of what a benzo would do, or an anti-anxiety medication, but it's somewhere in the middle between a supplement and that. So we are thinking of conditions like anxiety, PTSD, OCD, anything like that, where the neurotransmitters are just kind of off, creating some sort of anxiety or panic state. The difference between this one and other anti-anxiety drugs is that it will not cause sedation. There's no dependency risk, no withdrawal, so no need to taper down, which is nice. They have shown in studies that it can make drugs like Valium work a little bit better. And it can work really, really quickly. So you can use this one in acute conditions. Even dentists are using it now before dental procedures. Isn't that fun? And, but for some people, it can take a little longer for the maximum effect to be reached, because they do have a short half-life. So they do come on pretty rapidly, but the effect goes down. But if it's used every day, then the body almost kind of learns to create this new neurotransmitter pattern that's being stimulated, if that makes sense. So the second one is called Simactone, very similar. Again, a nootropic used for anxiety, depression. This one affects the BDNF, which has to do with the GABA glutamate balance. So kind of when people are really depressed, their glutamate levels might be low, and they might just need that boost to get motivated. So this helps without getting too stressed out. So this helps to modulate that. And even at high doses can be used for physical pain, which is really cool. So this one actually specifically increases dopamine and serotonin. So when I think of Selenk, I think of more anti-anxiety. When I think of Simactone, I think of more antidepressant. But they're very similar, and it really depends on the person's expression of anxiety and depression to know which one would be appropriate.
Right, absolutely. Yeah, and the Simactone also has that sort of nerve regenerative effect, right? So that would be a good option for, the Parkinson's, Alzheimer's, stroke, ADHD, all of those things.
Yeah.
And the other thing that I thought was cool about the Selenk is you can get it in combination with theanine and oxytocin. So, that is going to be a very, very calming, soothing, combination for the nervous system. Cool. Yeah, and Simactone is more for people that need the boost in their mood. And this is why, it is a very individual kind of prescription, where we're just sort of hitting on some key points of our favorites that we're working with now. But it's all done very individually. And by no means would somebody go out and start 10 different peptides. It's more specific than that. Mm-hmm. So let's talk through a little bit the logistics, because I do see we have a question here about working with long distance patients and things of that nature. Like we mentioned in the beginning, just to be perfectly clear and set expectations, these are prescription items. So what we are doing with our patients is we can work with long distance patients, but they have to be seen in the office at least once a year. And that is a legal requirement for us to be able to prescribe any medication. So that's true for all our patients and all our prescriptions. So we source our peptides from a compounding pharmacy out of state, and they will ship to us or ship directly to patients. So how it generally works is, say, for example, if a patient of mine, a current patient of mine who's been seen in the last 6 or 8 months, wanted to explore peptides, they would have a 30-minute consult with Dr. Peretzs to go over kind of what's going to be most appropriate for them. And of course, she and I now work closely together with our mutual patients. So she's privy to the health history and the background, and she can just really get the information that will help her to guide on what's going to be the best choice in terms of peptides. For people who are brand new to our clinic, it would require a new patient appointment, and that would be with Dr. Peretzs. So that's a 1-hour appointment, and that way she can get the whole health history, medications, what's happened so far. And then again, make recommendations about peptides. So it's not something that we can just kind of ship, and sadly, I know a lot of our friends are in Australia. I haven't looked into the availability of peptides in Australia, but it would, if they were there and available, they would need to be prescribed by a local doctor. So that's kind of the logistics of it. A question about how much the therapy costs. That's very variable, to be honest. I mean, what would you say, Dr. Peretzs, is a range? Sort of $80 through a couple of $100
so
perhaps?
I would say the average would be about 80 to 350. There's one combo I like that's sold as a combo that's around 700, but
Woo.
that's the only one I could think of. So that's the outlier one. But most of them fall in the 83 to 350 range for about a month cycle. And so a lot of people don't actually need to go past a month. Some people want to keep going and it's perfectly safe. But the idea is that we're sort of retraining things a little bit, which is incredibly possible and very doable. So it really depends on the patient, and also the dose may need to be changed, that kind of thing. So this is not meant to be like a forever thing, if that makes sense.
Yeah, and I know with the Thymus Alpha1, I mean, I remember just that one could be taken for several months at a stretch quite safely, and just to keep that immune kind of regeneration going. But other ones, it may just be a shorter duration, a shorter course. And once the healing is done, you don't need to continue doing the peptides forever. And so other people will also change peptides depending on what their priorities are. And priorities can shift. Like, that's getting better, but now sleep is off, or sleep is okay, but mood is off. And so this is where the adjustments can be made, kind of, on a monthly or bi-monthly basis. So it is, hang on, Sarah, sorry, what are you saying? I've got to move my window. Is that the price per peptide or for a combination? So they do range. The individual peptides could be $80, or they could even, be a couple of $100. It just depends on which ones. And like the nasal sprays are going to be a little bit less expensive, and it just depends on the individual peptides and, and the administration route, etc. And typically the sub-Q ones are shipped in a vial. And so, the patient would be provided with a prescription for insulin syringes and just draw them up, on a daily basis. And I would also add that not every peptide is done every day. There are some that are done 5 days a week. There was one I was looking at that was just once a week. That was sort of like an energy booster one. And so it varies too, how frequently you would be administering that.
Exactly.
Okay, Dr. Peretzs, what else have we missed? What else would you like everybody to know?
Let's see. I would say,
any final thoughts?
I don't know. I think we covered everything. I would say I've used NAD in a number of circumstances. I love it. I love it. The first time I used it, I was going through drug withdrawal, and it was amazing. Curbed my cravings, got rid of my paranoia, anxiety, stomach problems, everything. Recently, this week, I was just feeling really overwhelmed and just dealing with stuff around my apartment, and just kind of moody and wasn't coming out of it, and really tired. And I woke up the next morning, I didn't even snooze my alarm. Like, I didn't even feel the need to. I've never done that. So, and I just felt like my body felt very even, if that makes sense. Like, I just didn't notice I was holding tension or pressure in some places. I just felt really good. And that was a few days ago, and I still feel great. And so, I just love the idea. And that's why I love all this stuff. It's molecular. I like going in piece by piece, thinking about what the cells need, and very specifically directing, and there is a time and place for general wellness. But I love the idea of being very specific. So if that's something that also resonates, this could be a really good thing to try out. And especially if people are in that place where they've tried everything. If you've tried everything conventional, tried everything naturopathic, you're stuck. Like, this is a really nice approach that's also very gentle, without a lot of side effects. So it's really worth exploring or looking into.
Yeah, absolutely. So I just make that note too. We were talking about NAD and peptides today, but I also do want to point out, and what I love about Dr. Peretzs is her openness with her own journey and her experience with OCD. And she has a blog all about that. And so she's been through it. I mean, she just mentioned, like, she's been through the benzo withdrawals and having, like, looking at those conventional, the conventional options, I suppose, and just how that can negatively impact and how hard it is to get away. And that's what I love about especially the Salank and the Samax and whatever, because we do have patients who are taking benzos and they're difficult to get off. And I understand that when anxiety is through the roof and when you don't sleep with anything else, I get it.
Yeah.
But it's really, it can be very, very challenging. So I think this is a much more natural and gentle way. But the point I was trying to make with that is Dr. Peretzs has a real passion for working with people on brain health, mental health, emotional states. I mean, that's something that she really brings very specialized knowledge on and her personal experience. And I just love that she's very, very open about sharing that. We appreciate that about you, Dr. Peretzs.
Oh, thank you.
So Sarah asked, are you taking long distance telehealth patients? Yes, absolutely. Dr. Peretzs is open to new patients. And so if you were interested in scheduling with her, you would either call the office, and I will make sure on the handout we have that information, or you can just go through our restoremedicine.com website. Restore does not have an E on the end. So RESTOR medicine.com. And there is actually a scheduling link, so you can schedule online if you like, and we will get new patient paperwork to you. But Sarah, just bear in mind, again, wanting to be very, very upfront, if you are looking to do peptide therapy and you're a long distance patient, you would need to be seen in office at least once. For any prescription, that is the requirement, and so we stick to that. But in terms of amino acid therapy, in terms of all the naturopathic things that we offer, then absolutely you can schedule with Dr. Peretzs and do a phone or a Skype. We work with lots of people long distance. So, all right, I think we have covered it. Wow. And like I said, there are many other peptides out there. We just kind of hit on some of the really groovy ones for our chronically ill people. So if there are any other questions, feel free to reach out. We will be there will be a recording of this, so you can go back and listen again. And like I said, we are going to, with the link to the recording, we will also send that handout that went out on by email and on a blog last week, but just to make sure you guys have everything in the one place. So Dr. Peretzs, I want to just thank you for sharing all of that research. It's been very exciting for me learning about this because it's new for me. And that's what I love about, different practitioners bring their specialties, bring their areas of interest. And I know this is something that you're really excited about because you see the potential. And certainly we know that it's being utilized at some of the big Lyme clinics around the country. So I'm excited to be able to offer it. Dr. Peretzs, thank you so much for spending time with us tonight and sharing all that information.
Yeah, thank you. It's great.
Excellent. All right, everybody. Well, good to see you again, and we will see you very soon.
Bye.